Welcome. I'm Dr. Janice Baker of Veterinary Tactical Group, and in this webinar, we're going to talk specifically about management of bleeding wounds in injured canines. So before we get into talking about specific treatment guidelines, let's talk about having a plan, because you should have a plan for serious emergencies, whether it's bleeding or any other kind of wounds or illnesses, long before the injury or the illness occurs. When your dog is seriously injured or ill, that's not the time to be figuring out whether your vet is open, whether you can get a hold of them on the phone, whether they have time to see you, or whether they're capable of seeing you, because you have to consider that the closest veterinarian or the veterinarian that you like the most or like to work with the most might not be the best veterinarian in this situation. And nothing against them. It's just that not all clinics are the same. Not all clinics are equipped to handle major emergencies. I mean, even a lot of emergency after hours or 24-hour emergency clinics aren't capable of doing thoracic surgery, for example. A serious case like that might take a specialist for treatment. And also, do they have blood products for transfusion or 24-hour care, for example? And then things as simple as who's going to drive, because if you're the handler and you're trying to treat your dog, can you treat the dog and drive at the same time? No, you can't. So your other option is to throw him in the back of the dog box and hope that he's still alive when you get there. And things as simple as who's going to drive and who's going to treat the dog need to be worked out ahead of time so there's no confusion when it happens. If you're by yourself and your dog's bleeding, you can't really work to stop the bleeding and drive the vehicle. And so the alternate that we've seen so many times is just throwing the dog in the dog box and driving like crazy, hoping the dog's still alive when you get to the veterinarian. So having at least a basic plan of knowing where you're going to go, which veterinarian you're going to go to that is capable of providing that high level of care, and then also how are you going to get there, those two things can save you a lot of trouble. As many of you already know, when we talk about treatment protocols in the tactical environment or operational environment, meaning the environment before you get to veterinary care, we typically use what we call the March protocol, and that's listed here. That just prioritizes what should be treated first. And the first thing is massive hemorrhage or bleeding wounds. And that's what we're going to talk about in this webinar. We're going to stick on that subject, and in further webinars, we'll talk about the other subjects. Now, we know that before you approach the dog and assess to see their injuries, you have to make sure that the scene is safe. Now, that could be that there's gunfire going on. It could be that there's bad weather. It could simply be a dog that's run out into the highway and been struck by a vehicle, and there's still cars going by, unstable structure or unstable environment of any kind. So once the scene is safe, we're not really going to talk a lot about that in this webinar, but once the scene is determined to be safe, or if you're already on that scene with the dog and you determine that the scene's not safe and you have to get out of that situation, the only treatment that you might do, and that's only if you can do it without further endangering yourself, is start to control massive bleeding. So what kind of equipment should you be carrying for treating bleeding wounds and other wounds in dogs? There's the individual first aid kit, which is an IFAC, which is what we use for humans. And then we just modify it slightly and we call it a CFAC, or a K9 individual first aid kit. And the items inside this kit are actually pretty simple. It's meant to just treat massive hemorrhage, airway obstruction, and respiratory compromise. But sometimes we add other things like a digital rectal thermometer because of the potential for heat injury, and some other things that are adapted to the dog. But it doesn't have to be really complicated. Basically, there's a couple of compressed gauze, and you can have hemostatic dressings, which we'll talk about later, hemostatic bandages, but basically compressed gauze, some kind of chest seal or occlusive dressing, needles for chest decompression for tension pneumothorax, and then some kind of elastic bandage like an ACE type bandage. And some people have a tourniquet like a SWAT T, and we'll talk about tourniquets in pretty good detail in just a bit. But that's really all you need. And for the hemorrhage control, it's the gauze packing and that elastic bandage like an ACE bandage. And you might notice that there's no vet wrap or Coban. So when we talk about elastic wrap, we don't mean vet wrap. We mean like an elastic bandage, like an ACE bandage. And why is that? Why don't we have that? Well, here's a good example. The main reason is that it has to be dry to stick to itself to work, and once it gets bloody or wet, it doesn't work at all, and an ace bandage isn't going to have that same problem because you're going to tie that off somehow. And another good reason, just watch this poor guy struggle to find the end of the wrap. Once it gets hot and squished down in a bag, it's really difficult to find the end to get it open. So when you assess for bleeding in a dog, the main thing you want to do is assess whether this bleeding is actually what we call massive bleeding or life-threatening bleeding, or if it's just a big bloody mess. So let's take a look at these 4 situations here. The first one in the upper left is a dog he's got a little nick in his ear and it's bleeding all over the place. That is a big bloody mess, but that dog is not going to die from that bleeding. And it's going to trickle for hours. We actually had to take intervention and get it sutured up to stop the bleeding. But that in itself is not life-threatening bleeding. It's scary looking, it's really distracting, but not life-threatening. Now, slip over to the upper right. That is kind of hard to see there, but that's a 9mm gunshot wound through the front leg of a dog. The part, if you can see the hand there that's holding, that's my hand holding right underneath his wrist, and then his paws to the right, and that little black blob at the bottom of his leg of the picture is the exit wound of the 9mm. And this dog was shot in the field. He made it to us probably 15-20 minutes until he got to us. He received no treatment at all other than just throwing him in the truck and bringing him to us, and he didn't have any significant bleeding. So again, it's a big bloody mess, but you don't see any active bleeding, you don't see any blood spurting out of there, and it didn't require any interventions like transfusion. Now, the one in the lower left, we'll play this video and in a second, and you can see that blood. This is an experimental model in swine in a laboratory, but they've lacerated the femoral artery, and you can see the blood spurting out of there. That is massive hemorrhage, and we'll show you a video of that in just a minute. That is life-threatening hemorrhage that the dog could die from within a few minutes if it's not managed. And then on the lower right, that is a dog that's up into his groin, and he's been swiped at by a bear. It's a hunting dog that's been swiped at and clawed by a bear. You can see that there's a muscle that's just cut in half. That sort of blob in the middle of it by the fingers is a muscle belly that's severed in half. And then you can see some blood vessels off to the side, like onto the right, where I'm sorry, onto the left. There you can actually see the femoral artery coming in, and there's no blood. It's not bleeding, right? So lucky dog. This is after we've sponged it off in surgery because there was a little bit of pooled blood, but no massive hemorrhage, and surprisingly very lucky on the part of that dog. But once you've determined, do you have massive bleeding or do you just have a big inconvenient bloody mess? That will tell you if you need to treat it or not, if you need to do something right then as you're getting off the X, so to speak. So here's the video of that experimental model in the swine where they've surgically cut the femoral artery, and you can see the spurting blood there. And it's pretty fast. That arc is pretty high, and over time you're going to start to see that fade a little bit. That arc is not going to be as high. It's not going to be the pressure isn't going to be as great because 2 things. And one, the body is trying to constrict the femoral artery to stop bleeding, and also the patient is losing so much blood that their blood pressure is dropping. Now, this is what we would call massive hemorrhage, and they can bleed out pretty quickly within a few minutes from a wound like this. The great thing is that these wounds in dogs, especially working dogs, are pretty rare. When they do happen, it's usually from a ballistic round being shot up in their back leg, or also the same thing as up in their axilla or their armpit. Or they've jumped over something and impaled, like with a fence post or some kind of barbed wire or something like that. But overall, wounds in that area are pretty rare in working dogs. Now, we've all heard that arterial blood is brighter red and it comes out like a spurt, and then venous blood is a steady stream and it's a little bit darker. But the bottom line to that is it doesn't matter. They can bleed out just as fast from a large vessel venous laceration as they can from an arterial. So don't waste any time trying to figure out whether it was arterial or venous in the field. Just pack it and get it stopped, and then the surgeons can figure it out from there. Now let's talk about the most common areas for massive hemorrhage to occur in a working dog. Now, the most common areas to bleed are probably the face and the paws, but those aren't necessarily life-threatening. So life-threatening massive hemorrhage, massive bleeding in dogs is most commonly in the head, neck, and the thoracic inlet area, which is circled here. So the thoracic inlet is where basically the structures that are within the neck, like the esophagus, the trachea, and all of the major vessels go into the chest cavity. And that's in that little area there. And that makes sense if you think of hostile action injuries where there's some kind of bad guy involved, that if they're in front of the dog and the dog's engaging that person, there's about a 45-degree cone from the front of the dog where the person might engage them with a knife or a handgun or some kind of ballistic weapon. And also from a non-hostile aspect, if a dog is just running, they're going head and chest first, and that's the most likely part of their body to engage an obstacle, whether it's a fence post or a stick and coming out of the ground or a tree or any kind of object that can impale them or cause injury. That's the first thing that they're going to run into. Here are a couple of really good contrasting thoracic inlet wounds. The first one here, we see this dog was stabbed with a knife. It was about a 6-inch blade, went right into the thoracic inlet and presumably lacerated the jugular vein. The dog was bleeding like crazy. The handler tried to pack it initially with combat gauze and then regular gauze down the hole, but couldn't get good hemorrhage control because the wound was actually deeper than he could get the packing in there. So he packed it with combat gauze and regular gauze, put pressure on it. It had a lot of strike-through bleeding. He couldn't get the bleeding to stop. So he packed it again, combat gauze and regular gauze, and then put external pressure, or what we call indirect pressure. And you can see he's pushing down on all of that bandage material on top of the dog's shoulder blade. So between the shoulder blade and the body wall, there's vessels that run in there, and those are the vessels, or the vessel that was cut. So by putting pressure on the outside of the shoulder blade to press against that blood vessel, to press that against the rib cage, he was able to get the bleeding stopped. This second case is a great contrast to the first one in that the injury is in about the same area. And this was a bullet wound, went in the thoracic inlet. You can see that bloody part of that white patch of fur next to his shoulder. And it went in and it hit the shoulder blade and deflected out, came out the side of his shoulder. But he didn't have very much bleeding at all. He walked into the clinic, we treated him, he walked out of the clinic a few hours later. But it's basically in the same area as that first dog did, but the dog just got lucky and didn't have any injuries to any major vessels. So a big bloody mess, but not massive hemorrhage. The second most common place for bleeding wounds in working dogs are the front legs, and that's for the same reason that the most common area is the head, neck, and shoulders. It's just the orientation of the dog to whatever it is that's going to injure him, whether that's a person with a weapon or just obstacles in the environment. What we know from lessons learned in the field is there hasn't been an injured working dog that died that would have survived if only they had applied a tourniquet. And we know that that's just not the case in humans. But we also know that extremity injuries are some of the most common injuries that occur in working dogs. So putting those two things together, that extremity injuries that bleed are really common in dogs, along with the fact that dogs just aren't dying for not having tourniquets, tells us that the relative importance of tourniquets in managing bleeding wounds in dogs isn't as great as it is in humans. Here's a couple of good examples of how dogs can have severe injuries to their extremities and not need a tourniquet. And the second photo there of the dog being carried, that dog was shot through the radius and ulna. He has fractures in those bones. And all he has applied is just a roll of gauze, and you can see there's no bleeding coming through that gauze. Just that gauze alone was enough to control bleeding. And then the third photo there is a dog with a metacarpal artery bleed, and the pool of blood that's below his paw on that pad is actually from his paw. It's just pooled in the fur and is between his toes, and the bleeding is well controlled just with that elastic wrap. And the first photo in this lineup it's an artificial leg, but it's crafted to be the size of about a 70-pound dog. And we've got a cat tourniquet on there, and you can see that's twisted as tightly as it can possibly go, and it still doesn't really engage the leg. And we've stuck a pen underneath that easily just to show you how there's no real pressure on the leg. And that's just because the windlass apparatus, where the windlass attaches to the hardware on the tourniquet, that part is wider than the dog's leg, and it won't let it bend and compress the leg to any adequate degree. So in those rare cases where a tourniquet is needed, the windlass style tourniquets like this cat tourniquet here and others similar to it would just be too large and wouldn't work on the dog. And you'd need something like just something as simple as an elastic bandage, like an ACE bandage, or maybe a SWAT T tourniquet, something that you could get a direct wrap on the leg instead of relying on the windlass. Here's two studies that are pretty good examples of this evidence. And the first one studied gunshot wounds in military working dogs. And what we found there is first that extremity wounds were the most common injuries. And second, none of the dogs that had extremity gunshot wounds required tourniquets to stop bleeding. In the second study here, they looked at cardiovascular compromise, meaning shock, and most likely from hemorrhage, in relation to the location of the wounds. And there were 32 dogs that had gunshot wounds to the legs and no other locations to complicate the cardiovascular status. And 29 of those 32 dogs had only mild cardiovascular compromise, and only 3 of the 29 had moderate cardiovascular compromise. So basically, these dogs weren't in shock, didn't have massive blood loss or significant blood loss following gunshot wound to the legs. So, of course, we want to know why the injuries to the legs aren't that serious, where in humans they usually are. Let's take a look at the anatomy of the blood vessels in the legs. This diagram shows the blood vessels of the legs a lot larger than they actually are. Below the elbow and below the knee, the vessels are actually really small. And that's because the lower part of the dog's leg, as you can see here, really doesn't have a lot of muscle. There's mostly tendon, ligament, and bone, and a little bit of muscle. And while there is a blood supply to all of those tissues, it's just not as robust and big as it is in areas where there's a lot of muscle. And because of that, direct pressure right over the wounds is usually enough to stop the bleeding. And here are a couple of good examples of how dogs' legs just don't bleed that much. And the first one we've already seen, that's that 9mm gunshot that didn't get any treatment prior to arrival at the vet, in about a 20-minute transport time. The dog really didn't significantly bleed out. The bone was broken and it needed surgery, but the dog didn't need a transfusion. And the dog in the lower photo ran off from a farm, was gone for 12 hours, and came back looking like this. So it was shot with a high-powered rifle, and we could see fragments in the X-ray. The bone is completely obliterated. The leg is just hanging on by some tissue, muscle tissue and tendons and skin, but there's no significant bleeding. This dog didn't get any treatment in the field. Obviously, a human would have probably just bled out and died from this, but this dog came back home on its own, and when it came into us, it hadn't lost a significant amount of blood. It didn't need a transfusion at all. Its blood count was essentially low normal. This next dog has a laceration on one of his metacarpal arteries. So the metacarpal arteries are two arteries that run down the sides of the back of the leg, and this dog cut it on some wire. And it came from about an hour away. They had put sort of a makeshift bandage tourniquet-ish thing on it that really wasn't effective. The bandage was pretty bloody by the time they got to us. But you can see how easy it is to stop the bleeding. I just put my thumb on direct pressure on the artery above the wound, and it stops. Here you can see the technicians putting direct pressure on the wound just to help it stop bleeding. And an interesting thing that got us sidetracked for just a minute was that as we were bandaging it, we saw blood coming up through the bandages like strike-through bleeding, which would indicate that the hemorrhage isn't controlled. But we knew with as much pressure as we had on there that this wasn't active bleeding. What was happening is there was blood pooled in the dog's fur on his paw, on his leg, and as we put the bandages on it, that blood was just coming up through the bandages. So we did something that we'd never do in a pre-hospital setting, but we would do in a clinical setting like this, is that we took the bandages all off, we cleaned off the leg, got all the blood off, and rebandaged it. And that's just not something you would do in the field. You just apply more bandages on top of it. So if you learn from a veterinarian or veterinary technician how to properly place a self-adhesive bandage like vet wrap, or if you are a veterinarian or technician, you know that we've always been told don't wrap it too tight because it can cut off the circulation and it can cause the lower limb to swell. Well, when the dog is bleeding, cutting off the circulation is exactly the point of the bandage. And so don't worry about wrapping it too tight. Don't worry about the sort of long-term bandage care. Wrap it as tightly as it needs to be effective to stop bleeding, and then let the veterinarians worry about releasing it and getting the circulation back. So how long is too long? How long can you leave a tight bandage on a dog without doing permanent damage to nerves or blood vessels? We don't really know. Nobody's ever studied that, but we do know that it's okay probably to have it on for a couple of hours, and then by that time you can get to a veterinarian and have it loosened. And if you are in some austere environment where veterinary care just isn't going to happen, put it on for a couple hours and then slowly start to take it off and assess for bleeding. But as we've discussed already, bleeding in the lower limb of a dog stops pretty quickly with some just pretty consistent, steady pressure, and you probably won't have to leave a bandage on very tightly for longer than just a few minutes. Traumatic amputation, where a lower part of the limb has been completely or partially separated from the upper part of the limb, that's one of the few situations where we might use a tourniquet. And the reason for it is because when you have a stump like this, in this case with dog versus lawnmower, and he's lost the tip of his paw, it's really hard to apply direct pressure to that stump and get enough pressure to do much good. So we use a tourniquet or a tourniquet-like effect. Generally in the field, it's an ACE bandage or a SWAT T tourniquet or some kind of elastic type material that you just wrap really, really tight. And I know with humans, they say high and tight. It just doesn't seem to matter in dogs because of the reasons we mentioned earlier with the smaller size blood supply and not very much muscle. So you can go directly above the wound. In this first photo, I'm literally just grabbing onto the paw right at the wrist and squeezing, and that's stopping the blood enough for us to get a good look at it. And then in the second one, you can see we've applied a vet wrap or a Coban tourniquet-like effect up above the wrist, and so we can clean it and prep it and get a better idea of what we're working on before we take it to surgery. Moving on to the third most common area for serious bleeding wounds in dogs, that would be the rump and the groin area. And in this diagram, these vessels are drawn a little bit more to scale. They are really large compared to the vessels on the lower part of the leg. And because of that, if they're lacerated, they can bleed quite a bit. Now, these injuries are pretty rare, but when they do occur, they can be life-threatening. The dog in this photo was shot in the rump, in the buttocks, and the round went from behind him into his buttocks, down the inguinal canal, and came out next to his prepuce or his penis. And amazingly, didn't hit any major vessels. But look at this dog in this picture, and there's blood everywhere. And that's because he was leaking blood a little bit out of the wound, and his tail was picking it up, and he was wagging his tail and getting it everywhere. And the dog was walking and was doing quite well. They only have him down here to examine him better. And I wasn't currently at the site where he was evac to, but I got the report at the location I was at, and it said that the round entered next to his asshole and exited next to his jimmy, and pardon the language, but that was the perfect description because everyone that saw that report knew exactly what was going on with this dog. This is a video of wound packing, how you would handle it if it was massive bleeding. Now, this is a cadaver specimen that's rigged up to artificially bleed. And what's important to note here is there's not a lot of theatrics. He doesn't do any supposed cool guy hacks, throwing the gauze over his shoulder or anything like that. He crumbles it up into a little power ball. He puts that directly on the area that he feels is bleeding, and then he holds that hand there while he feeds the gauze in with his other hand. In a lot of cases, the dog's not just going to lie there and let you do this. We have to keep that in mind. If the dog is still conscious, they'll be up and trying to fight you, and they won't want to lay down. But eventually, with this massive bleeding, they're going to start to lose consciousness, or they're going to get at least tired, and it'll be a little bit easier. But this video demonstrates wound packing. So up to this point, we've talked about wounds on the extremities that you can wrap, and then wounds that are in what we call pocket wounds up in the armpits and the groin, or big chunks of muscle that are missing that you can't get a wrap around really. Then you pack those. And it might be a combination of both. So say in the case of this example with the cadaver, you would pack that wound and try to get direct pressure on the bleed, and then you'd put the legs together and do a saddle wrap or like a pelvic wrap to put pressure on those large leg bones, to put pressure against the pelvis and trap the bleeding veins or arteries between those, just like with the shoulder injury on that dog with the stab wound. Hemostatic agents or hemostatic bandages are products that have substances within the gauze or the product that help stop clotting. And there's different ways and different methods and materials that they use for that. But they're really common in human medicine. You see a lot of combat gauze is one very popular one. And then the X-Stat, which is that big plunger looking one. Those are commonly used, especially in special operations and all of that. But the thing with this, just like tourniquets, is there hasn't been a case of a dog that if only we had a hemostatic agent, he would have survived, but he didn't because we didn't have that agent or we didn't use that agent. Now, in the dog that we showed in the beginning that had the knife wound, they did use hemostatic agents on that dog, and that might have helped. We don't know. We don't know what would have happened if he wasn't using it. I think it was the overall actions of that handler that saved the dog. But the hemostatic agents, they're safe to use in dogs. They're tested on animals long before they were used in humans. But the thing about that is they're pretty expensive. And if you just use regular gauze and regular materials appropriately and aggressively, you probably don't need combat gauze or the hemostatics. Now, there's no reason not to use them. If you have them or if your unit will get them, that's great. But they expire and they're really expensive. So if you don't have them, don't panic. That's your dog's not more at risk. If you just use the basic gauze and direct pressure and the wrapping in an appropriate way, that's probably going to be just as good as using a hemostatic agent. The fourth most common location that we see bleeding wounds in dogs is in the lower rear limbs. And since the treatment is essentially the same and the way that they appear is essentially the same as front legs, we're not going to cover that again here. Just treat them just as you would with front legs, with direct pressure and, as a last resort, a tourniquet if you can't stop bleeding or if it's a traumatic amputation where there's nothing to put direct pressure on. And finally, we're going to talk about a location and a type of bleeding that you just can't treat effectively in the field. You can do some treatments, but it usually won't be enough to stop the bleeding. And that's non-compressible hemorrhage or hemorrhage in the thoracic cavity or the abdominal cavity. In working dogs, most injuries that penetrate the chest cavity or the abdominal cavity don't do it from the side. Most of them come from that same 45-degree angle of injury that we described earlier. And as you can see here, if that ballistic round or whatever it was that penetrated the body continues to go through the body, the injuries aren't just located just where the hole is. So it's really important that if you see a hole in the chest or an injury like up in the front of the chest, that doesn't mean that the injury is just located there. It could be anywhere in the body. And we know from experience that once something like a ballistic round enters the body, it could shatter and go all over the place. We have experience with dogs that have had slight injuries that up in the chest, like an entrance wound, but there were fragments in the liver, for example. So don't be fooled by just seeing where that hole is. That means that that's the only injury that there is. The bleeding might be inside or the damage might be inside the dog. So treatment for these kinds of wounds can be pretty frustrating and pretty scary because there's nothing you can do directly to stop the bleeding until you get to a veterinarian and you can get to surgery. So you can do supportive care, which means preventing hypothermia, keeping them warm, provide oxygen by mask if you have it. There's blood transfusion depending on what your environment is. If you're in a really remote, austere environment, dog-to-dog blood transfusion is possible. And then, of course, evac to advanced veterinary care for surgery. Some organizations have the capability of providing canine blood transfusion in the field prior to arriving at veterinary care. And there's some of these organizations, both military and civilian law enforcement, that will carry canine blood products with them if they know they're going into a high-risk area or high-risk situation. Just like in humans, blood products are preferred over fluids. You shouldn't give crystalloid fluids, which means like lactated Ringer solution or sodium chloride. You shouldn't give that to a dog that's hemorrhaging because when you raise their blood pressure and you dilute out their clotting factors, you just push the remaining red blood cells that are needed for oxygen carrying out of the hole that's bleeding. So we don't use fluids at all. We haven't for a long time. but the primary fluid to give dogs for bleeding is to replace the blood. Dogs do have blood types, but they're not as reactive as humans are when they get the wrong kind of blood type. So if you're in a really remote area and you don't have prepared canine blood products on hand, you can take it from one healthy working dog and give it to another dog. And about 1 unit, which is about 450 milliliters, is the maximum you can take from one dog at a time. This isn't something that you can just do on the fly. You have to have the proper equipment and the proper knowledge on how to do it. But if your organization expects to be in sort of these more austere environments and they have medical training, they have medics with them, this is something that a lot of them can do, certainly in the military. So this list here is just the preference order in which we want to use products if they're available. The first one, fresh whole canine blood, means it's been collected from a dog less than 24 hours ago. It wasn't refrigerated and it's given straight to the recipient dog. Stored whole canine blood is blood that was taken from a dog and refrigerated and can be used up to about 28, 30 days after it's drawn. Packed red blood cells and fresh frozen plasma in a 1-to-1 ratio. So packed red blood cells are just red blood cells that can carry oxygen, and most of the fluid, the serum and the plasma, have been taken out of that mixture. And then you add a 1 unit of fresh frozen plasma, which contains that volume, that plasma, the clotting factors, and other things that are needed for clotting. And then the final thing is you establish an IV or intraosseous access, but don't give fluids. And crystalloids just means the fluids that are most like the blood in our body. So normal saline and lactated Ringer solution, but don't give those fluids. But it's okay to establish the access while you still can get a vein. Tranexamic acid, or TXA, is a product that helps the body undergo proper blood clotting after a major trauma where there's lots of hemorrhage. Now, that's a very simplified version of how it works, but for the purpose of this webinar, tranexamic acid is something that a lot of human paramedics and tactical medics are carrying in the field, and it is used in veterinary medicine on dogs that are undergoing major surgery, like orthopedic surgeries that are expected to bleed a lot. It's just now being studied in trauma in dogs, but we do know that it's safe, and we believe that it's probably effective. The results aren't out on any studies yet, but it has been used in dogs for trauma in the military. And the reason it may be helpful is that after a massive hemorrhage with major trauma, the blood initially starts to clot the blood, but then there's this other cascade that comes along that tries to break that up, to not let it kind of go overboard. And that fibrinolysis, which happens after the initial clotting, can actually degrade the clots enough to keep the patient bleeding. So TXA works to prevent that process and sort of make a more stable clotting process overall. So while TXA is gaining some popularity and understanding in veterinary medicine as it is in human medicine, it's not really readily available. Most clinics don't carry it. It's more like something that your tactical medics would be carrying, and then them just being educated that they can use it on dogs. And the treatment is very similar to how it's used in humans. And the one protocol for use is written here on this slide. Let's recap what we've discussed in this webinar. First, the most common serious injuries in dogs are at a 45-degree angle from the front of the dog. And that's simply because that's how they engage the world. That's how they engage bad guys. That's how they engage obstacles when they're moving in their environment, doing their job. Tourniquets are rarely needed for bleeding from the legs, the lower legs. From the upper legs, like the elbows and up, in humans, we can fit a tourniquet on the upper part of our arm. Dogs can't, because that part of their upper arm is attached to their body wall and you can't get a tourniquet around it. And below that, the muscles are so small and the blood vessels are so small that tourniquets are rarely needed to control bleeding. Just direct pressure is usually enough. And the exception to that is a traumatic amputation, where most of the lower leg, or the lower leg, is either completely avulsed from the dog or is hanging on by a thread, and there's a stump and you can't get direct pressure on that stump. Now, if you can't wrap it like a limb, pack it, right? Lower limb injuries, you're going to wrap groin and axle or armpit injuries or big chunks of muscle missing, you're going to pack with gauze. But if it's over the chest or the abdomen, you're not going to do that because you could put the gauze directly into the chest and abdomen, and you don't want to do that. And finally, external wounds might not show the extent of the injury with internal injury. And if you think of that line of fire of the mechanism of injury that we showed in that chart, when something penetrates the dog and keeps going, like a ballistic round, it can not only injure the area it went through, like in the chest or in the front of the chest, but it can go through the chest cavity and even into the abdomen or other places, and you just can't tell where it is. So don't be target focused or fooled by that little tiny hole on the outside. Think of the path of travel and where that mechanism of injury came from, or where that ballistic round came from, or obstacle that they impaled, and what other organs it could be that could be injured. Finally, there's some more advanced treatments that might be available to you depending on what is issued to you or what equipment you have or what kind of medical support you have with you. Now, hemostatic agents really aren't advanced at all. They're often issued to first responders like law enforcement, canine handlers, and military people that aren't necessarily medically trained. But TXA, to prevent that bleeding disorder that we talk about that occurs after massive hemorrhage with trauma, that might be available depending on if you're working with tactical medics or a unit that is carrying that. And it's up to you, if you're a canine handler, to let them know that it can be used on your dog. Blood transfusions as well. There are military units and some other law enforcement units that work in particularly hazardous situations, and they carry canine blood with them, like packed red blood cells or canine whole blood. Finally, let's sign off with a dog named Billy. Billy was a military working dog that was overseas in the conflict, and he was shot in the chest, and he bled so badly that he had his entire blood volume transfused back to him. And they did that with a walking blood bank. So when they found out that Billy was coming in and he was bleeding a lot and he was going to go to surgery, they gathered up all the other dogs in the kennel and they drew a unit of blood from each dog and gave that back to Billy. Billy not only survived his injuries, but he went back to duty and eventually was transferred from the military to federal law enforcement, where he lived out several more years as a working dog and finally lived a great retirement with his handler when he was all done with service. So starting from the point of injury care for this chest wound, which you can't really do much about in the field other than supportive care, but they treated him appropriately for that, got him to veterinary care. The veterinarian realized that this is a really serious injury, and the human trauma team that they were stationed with took the dog into surgery and did the surgery on the dog while the veterinarian coordinated the blood transfusion. And everybody knowing what to do and not panicking and having a plan was what ultimately saved Billy with these really serious wounds. So when you're faced with a dog with serious bleeding wounds, do the basics very well. Have a plan, know your equipment and know how to use it, and don't sweat the cool guy hacks and the advanced gear that you might not have. You have everything you need in a basic individual first aid kit to treat a bleeding wound. That's all for this webinar on treating bleeding wounds in working dogs, and we hope you never have to use this information. But if you do, we also hope that we've helped prepare you enough to deal with whatever you face. If you have a situation like this or using this information, please let us know. We want to know how it went for you. We want to know if our information helped or if we could modify it in any way, because we honestly do adapt and modify our webinars based on your lessons learned in the field. Thank you very much. See you next time.